Dr. G here with naturalfoodsdiet.org. The costs of diabetes continue to increase, both the medical costs and the loss of productivity, which is now at an estimated $250 billion every year. The CDC estimates that 29.1 million people have diabetes in the United States. 21 million of those are diagnosed, and 8.1 million of those are undiagnosed. In addition to that, 37% of adults in America have prediabetes, and an astounding 51% of Americans over the age of 65 have prediabetes. In fact, that's the new normal. Type 2 diabetes used to be called adult onset diabetes, but we don't call it that anymore, and there's a damn good reason. In fact, last week I saw a report on Reuters where a 3-year-old girl was diagnosed with type 2 diabetes. I think this is a big clue that it's not just about the diet, that there are environmental factors at play. Mainstream medicine's answer to diabetes is to develop new drugs. And of course, we have many dietitians that still put people on a low-fat diet, and of course, high complex carbohydrates, and that doesn't work for diabetes. New drugs come onto the market. A couple years ago, Invokana, a sodium glucose cotransporter 2 inhibitor, SGLT2 inhibitor. A synonym for inhibitor could be poison. I'll discuss that in a minute. There are other diabetic drugs in this same class. So the SGLT2 transporter is in the kidney. And when you take Invokana, you block the kidney's ability to save your blood sugar. Studies show that you can actually lose about 100 grams of glucose every single day when taking this drug. And this can be good for diabetics because they have high blood sugar and their blood sugar goes down and their hemoglobin A1C goes down and they tend to lose some weight. And overall, their blood pressure goes down. Although the blood pressure can go too low, causing fainting and dizziness and dehydration. The drug also on the negative side tends to raise the LDL cholesterol. They don't know the significance of that. The drug can also cause the potassium to go up. And in the initial trials, the stroke risk went up a reported 46% in the first 30 days of treatment. But the numbers were low, so the FDA said, hey, we can handle a few strokes. We can handle that. Now, more common side effects include vaginal yeast infections and urinary tract infections. And these are up to 6 times higher than if you're not on the drug. But I would expect that, and you would probably too, if your pee is syrup. You're feeding the critters with all that sugar in there. But this is typical of modern man and modern medicine. Instead of facing the fact that our environmental exposures and diet have gotten out of hand, we want a pill that causes us to piss out our blood sugar. It's a dream come true for diabetics. What's the cost? The measly wholesale price is $8.77 per tablet. And if you pay for it, it's over $400 a month. Of course, many diabetics have health insurance. So part of the cost is covered by the insurance. So we all end up having to pay for it. The drug companies keep coming up with these drugs, and sometimes they turn out to have side effects, some of them fatal, like Avandia did, but the drug companies don't really care. Why don't they care? Because Invokana is on track to take in $667 million next year. And this is getting very close to the holy grail of the billion-dollar drug that we bow down to. Back in May 2015, the FDA issued a safety announcement warning of the possible risk of increased risk of ketoacidosis with the use of this drug. Now, ketoacidosis can be fatal. And in addition, just the other day, that's this month, September 2015, the FDA issued another safety advisory. Studies note that there's an increased fracture risk and lowered bone density with the use of these drugs. One study noted that the fracture risk increased as soon as 12 weeks after starting the drug. The fractures, interestingly, tended to be in the upper extremities and were due to low trauma. Now, what does low trauma mean? It means it wasn't an auto accident. It was Fido pulling too hard on the leash that broke these bones. But you might be saying, I'm not on Invokana or that class of drugs. I'm on Januvia or on Gila or Tradjenta or Nicena. These are DPP-4 inhibitors. And yes, these drugs are also very expensive. Januvia is taking in $6 billion a year in sales. There's lots of potential side effects with these drugs. And there was a belated FDA warning again this month, that's September 2015, that this class of drugs can cause severe and disabling joint pain. They warn us now when the drug was approved 9 years ago. I can only imagine how many people suffered with severe and disabling joint pain, maybe even had their joint replaced. But I know joint pain is really rare, so I won't go that way. But I started thinking about this, and then I remembered that Januvia in this class of drugs was discovered by analyzing the poison secreted by the salivary gland of a Gila monster. This is a lizard that lives in my backyard here in Arizona. I go out and play with them all the time. Now remember, most drugs act by inhibiting or poisoning something, usually an enzyme. Now that's why it's often productive to analyze poisons to discover new drugs. So let's think about this. Severe and disabling joint pain. Maybe that's what the Gila monster had in mind, to slow down the pack rat that he just bit. Just saying, it's possible. Everybody's wanting a magical pill to cure them. Diabetes can be prevented, always, and in some cases can be reversed, but it's not easy. It's not as easy as taking a pill. It means fixing your environment, including fixing your circadian rhythm and metabolism by getting back into contact with nature, cutting down artificial light exposure, improving the nutritional content of your diet, and cutting down on refined carbs and refined oils. Now I know it's not as easy as paying $500 a month for a pill. It takes getting out of your comfort zone and making some hard choices. But the results are incredible. You'll get a normal blood sugar, and at the same time you'll improve your bone density, and you'll reduce your risk of a stroke, or you'll reduce the risk of these other poisonous side effects that we get from the drugs. This is Dr. G. Thanks so much for watching, and please subscribe to our channel.